Hi Taral, hi Vineet, hi everybody.
Hi, sir.
Hi.
Check Ravindra join. Abhishek.
I'm trying to call Ravinder only. Ravinder is logged in. Just take him in, Asmita.
Yeah, he is in the
Yeah.
attendees. Yeah.
Indeed.
I've seen after ages to Taral. Oh, great to see you, Taral.
Yes, same here. Great initiative. I like the name.
Yes, all hard work is done by Hita.
Yeah.
And Abhishek, just tell Palande to join. Asmita, Ravindra Singh was in attendees. Can you have him here? Perfect.
Good evening, everybody.
Hi, good evening. Good evening, sir.
Yes, sir.
Thank you very much for obliging us at last moment.
Are, sir, my pleasure.
So, shall we start, Hita? Wait for 1 minute.
Yes, sir.
Good evening, ladies and gentlemen. It's a pleasure for me as President, Indian Federation of Neuro Rehabilitation, to present you yet another domain in the field of multidisciplinary team and neuro rehabilitation. Along with me is Abhishek, the Secretary of Indian Federation of Neuro Rehab, and Hita, who is the team leader of this concept and program. So, what is IFNR Sati and why we really think that this should be an important part of the multidisciplinary team? This IFNR Sati is an IFNR initiation to create neuro rehabilitation information, guidance, and support for people and families living with neurological condition. And as you all know that a diagnosis, a neurological diagnosis should not come but with no map forward. It's like, many times patient relative don't even know what they are dealing, what is the future. So Sati is something which the purpose is to make reliable neuro rehabilitation information which are more accessible to people living with disability related to neurological illness, their family, caregiver, and even the professional across India. Information is fragmented at the moment, so the relatives, families keep on searching the guidance. Somebody comes out with, should I do this? Should I go for that? Should I do this? Whatever they look into the Facebook or Instagram or any other social media, they want to do that. So, as you all know, there are geographical and language barrier. Reliable support should not depend on which city or which language you are talking. So we are now talking about global India. And even in many cases, after the neurological illness, the rehabilitation become an afterthought. When everything else is not working, then they say go for rehabilitation. So what is our mission? What is our vision? And how we are going to govern it? To make trustworthy, plain language neurorehabilitation information freely accessible to every person and family in India living with neurological condition. And it will be equipped with healthcare professional and community to support them well. Our vision is, and as in India, where no one, navigate a neurological condition without a clear pathway forward, where reliable information, verified local support, and the trained neuro rehab workforce are within reach, regardless of geography or language. So, how we are going to keep it trustworthy? One, content is developed and reviewed under IFNR clinical oversight before publication. Two, every published item carries a named reviewer and a review date and a source. Three, state-specific information is verified before it is listed and rechecked on a schedule. Four, IFNR's governing body retains the final editorial authority over everything published. So, how the IFNR Sati looks like today? And this is what 14 condition areas in the framework, 14 rehab discipline explained, 8 Indian language is being planned, 7 steps in rehab pathway. So one framework for all the 15 condition, and you will see when the website will be inaugurated by none other than Professor Ravindra Singh, the scientist, senior scientist from the ICMR. Today we are going to have one live today, that is on the occasion of Spinal Muscular Atrophy Month, and the day SMA Sati will be launched today, which will go live. The other 14 conditions are already mapped in platform, and their launch will be related to their national day, which may include the stroke, cerebral palsy, spinal cord injury, and others. So this is India's first companion, lived since 25th August 2026. As you all know, the SMA affects muscle, not the person you love. SMA Sati gives families practical help for everyday care, therapy, breathing, feeding, treatment, rights, and school in plain language made for India. And we will have many person and caregiver who had been suffering with SMA or SMA related problem. They are here and they will be addressed today by an expert panel who have been treating this condition and giving them the guidelines. There will be practical tools, sources which you can check. So there will be a rehab planner we will provide. There will be a discussion topic generator for family to prepare for their care team, not a prescription. There are evidences and sources which will be available. Every clinical claim carries a name, dated, and checkable citation, not a vague reference. Why clinician and family can both trust it? Name reviewer every items, verified before it is listed. Nothing typed is stored. IFNR holds the final authority. So a clinical team, not just a product team. So we are not just a production or a movie maker. We are a clinical team, which is had many young multidisciplinary team part of it, taking initiation and participation in this. So behind the IFNR Sati, there are neurologists, neurosurgeon, pediatrics, neuropediatric, physio from all across the India who are working along with IFNR's leaderships. And you could see the full, when you go onto the website, you'll see the each name. So with that, thank you very much. IFNR Sati will be live now after once Ravindra Singh will connect it. And this is only the first Sati of many which are going to come. So I will now link to the IFNR Sati. So it is a step towards the empowerment, knowledge, support, and strength. And it will provide the patient resource website. And we are extremely delighted that Dr. Ravindra Singh is going to inaugurate it. So, Dr. Ravindra Singh, you need to click on your screen. 1, 2, and 3. So, thank you very much, Ravinder ji. साथी का अर्थ है संगी या हम सफर जो हर कदम पर आपके साथ चलता है, यही भूमिका IFNR साथी निभाता है. And before I take into the multidisciplinary session, may I request Ravindra ji to share his thought and few word on this initiation and how he could also guide us further to take it forward.
Thank you, sir, and good evening, everybody. It is great honor, privilege, and my happiness to inaugurate this IFNR Sathi. Whatever information Dr. Nirmal Surya had shared, I think it's enough to convince anybody to use this platform for evidence-based information. I think because in line with the global thinking, this would be a great asset for everybody, from patients to the professionals. And I think with the more and more time, and now with the AI and other tools available, this would be a great tool in the hand of the patient and professionals to manage various health conditions related to neurological health. So again, once again, congratulations IFNR for coming out with this idea, actually implementing it. We have so many idea, but we are not able to implement. So this reaching at this stage is a great step, and I think I'm looking forward for the impact of this platform on the care which we would be able to provide to the in the hands of. Actually, this is like strengthening the hands of the both the professionals, the families, and the patients. So again, it's again my honor, and actually, I'm not in a place where I can sit. I'm right now in Srinagar, and so I had to stop wherever I was. It is the golf course Chashme Shahi. So from there, I am logged in. So thank you, Dr. Surya and IFNR team for giving me this opportunity, great opportunity to connect and to inaugurate this system. Thank you very much. I
Thank
think
you
I will
very much.
log out after this because it's going dark here. So thank you again
I
and
highly,
honored.
highly appreciate and thank you for taking out time, from your travel and tight schedule. We extremely appreciate and we look forward to your comments and support for
Yeah.
the future.
Thank you, sir.
Before I take into the session, may I request Abhishek to say a few words? It is the initiation of IFNR, and I think please say a few words and give a vote of thanks.
I think it's a brilliant initiative. As we all know, holding hands of the caregiver and the family is the most important concept in helping people in their rehabilitation journey. And having verifiable information which people and families can trust helps them a lot in building their knowledge and their journey in their career for the professionals also. So thank you, Hitav. Thank you, Surya sir. Thank you, Team IFNR, for brilliant initiative. And I hope today's discussion, focusing on one concept of SMA, will take it forward and we'll work hard to include all the 14 conditions to make it successful. Thank you very much.
Thank you, Abhishek. And I now hand over to the moderator of today's session.
Sir, before we go on to that, sir, there were 9 people who are a part of this, sir. So if you can just
I know.
acknowledge them.
Yeah,
Yes.
I will just go through this. 1 minute.
Yes.
So let me go on to the initiation. Today, the panelists are Vineet Jason, who is Associate Professor and in charge of Neuromuscular Center of Excellence at CMC Ludhiana, with interest in neuromuscular disorder, community neurology, and healthcare system. The Alpana Kondekar, the DNB Pediatrics, Fellow in Pediatric Neurologist, Professor Additional from Department of Pediatric, Nair Hospital. And she is the one who had the SMA multidisciplinary team clinic at TNMC and BYL Charitable Hospital. Dr. Taral Nagda, who is MS Orthopedics, senior consultant, and he's been involved with various activity in of IFNR and a lot of work in cerebral palsy and other deformity correction. Dr. Mona Patel is pediatric physiotherapist from Spurs Pediatric Rehab Clinic, Ahmedabad. And she has been faculty for various SMA awareness. Ms. Vrusuti Raj Nishar, who is a psychologist, MA in clinical psychology, and she has been doing neuropsychological assessment, cognitive stimulation therapy from Kokila Ben Dhirubhai Ambani Hospital. Dr. Pavitra Kannan is a speech and swallow pathologist from Narayan Health Group of Hospital, Bangalore, and she has diverse experience in field of neuromuscular rehabilitation. And of course, Dr. Sharuja Sarab Garmode, who is an occupational therapist with extensive experience in neuro rehab based in Mumbai from Jeet Child Development Center, professional interest in child development therapy. And the most important person here is Rustam Irani. He is the one who has been a motivator for many SMA patients and caregivers. He is the one who represent the SMA. He writes, he is a filmmaker, and he is the one who is conquering the disease SMA. Actively involved in advocacy, and I had pleasure in interacting with him in April during the public forum meeting at our Tele Neuro Rehab conference of IFNR, and we look forward to have him involved in more and more awareness activity on this platform. But the 9 people who really supported are, if I may ask Hitav to name all of them, including our my 4 mentee. May I request Hitav, you name them because I
Yes, sir.
might miss out.
No, no. So the whole program was the whole IFNR Sathi and the other Sathis that are coming out were formed by Ananya Sharma, who is a lecturer in the Department of Physiotherapy at St. John's Medical College and Hospital, Bangalore. Dr. Arun Shivraman, who is a consultant neurologist at NG Hospital and Research Center, Coimbatore. Dr. Guan Ramamurthy, consultant neurologist, the chair of the Neuro Rehab subsection of IAN and the consultant neurologist at the BG Institute of Neurosciences, Tirchandur. Dr. Hetal Shah, who's a consultant neurophysiotherapist at the ASIA Physiotherapy Clinic. Dr. Khushi Thakkar, who's a consultant at Someshwar Neuro Center. Dr. Nikita Das, who's an assistant professor of physiotherapy at Dayanand Sagar University in Bangalore. Pushkar Topkar, who's the head and founder of Umed Pediatric Rehabilitation Center from Kolhapur, and Shruti Murthy, who's the chief consultant and co-founder of the UMED Pediatric Rehabilitation Center, Kolhapur. So through this, taking permission from sir, all those who want to be a part of it can write to us, because this is just the beginning. We are yet looking for translation, because that is how we will be able to reach more and more people. So we've got out the English. Once the English is satisfied, the translation becomes easier. So please write to us on ifnr2012@gmail.com, and we will take you on board, and under sir's guidance, we will be.
Exactly. And I even don't mind, the patient themselves being also the part of it. Because if patient and caregiver who are very active, they can also write to me and they could also be part of this initiation. Because, of course, everything what we are doing is to see that they get the best available information and guidance. And if they have any, we would be very happy to have them on the board with us. So over to you, Hitav and Alpana, to take the evening forward. And there are quite a few people have been here. That means this program is being accepted by many of them. And I'm sure over a period of time, we will see not 89, 90, but 900,000 people being actively involved with various Sati program. And I once again want especially thank Rustam Irani. He is the big force behind the SMA.
Please,
And
sir, please, sir. I was already honored by involuntarily being called doctor for like at least 20 minutes. So I think that is credit enough. So I really appreciate and thank you so much for letting me be a part of this initiative and inviting me today. I'm actually very, very pleasantly shocked. And like, this was something that an individual like me dreamed of way back in 1993, almost 33 years back when I was first diagnosed, and the diagnosis only was possible outside of India. And now to see that we've come so far that finally we have something, an initiative like this that is such a collaborative, multidisciplinary approach. It's something that even the doctors in America would not have actually advised me, which I'll come to later when I'm getting the question. Like, it's when a doctor is faced with a chronic condition way back when, like almost 3 decades back, forget the idea of telling the patient that there might be any possible cure. The idea of having something multidisciplinary or even like a long-term treatment was not something that came naturally to a consulting neurologist or a neurosurgeon at that time. For them, it was just treating whatever the case was and just giving the end case scenario of sorts. And now to see us having evolved to such an extent where we are at this stage in India, it is a really a proud moment, and like hats off to the entire team and what you guys have achieved. So over to you. Yeah.
thank you. So without wasting much time, may I request Hitav and Alpana to please start the session.
Yes. So, sir, you've done half of our job of introducing the panel. So, let me take this pleasure of introducing Mrs. Alpana Sharma, who is a mother of a child of SMA, and that is the biggest, recognition that someone needs when it comes to this field. And along with that, she is a sole sister and trustee of the Cure SMA Foundation of India, who is a strong advocate group running helter shelter, running from pillar to post, knocking on different doors to get some help and some awareness and some advocacy for SMA. So I welcome you, ma'am, Ms. Alpana Sharma, to this program, and IFNR is happy to be a part associated with Cure SMA Foundation. And I say this on behalf of Sir and all the directors of IFNR, that this is something that we want and this is something that we look forward to in the future as well. So, ma'am, just if you could share some light on what Cure SMA is, and then we can go on with our first rounds of questions, please.
Sure. Thank you. Thanks a lot, Dr. Hita, for the lovely introduction and the warm welcome. And thanks a lot, Dr. Surya and Dr. Abhishek and all the esteemed panelists and IFNR for, uh, uh, launching this platform and being together for this much needed initiative. This is an initiative which, has been, as Dr. Hita was also saying, I'm also a mother of a 14-year-old SMA type 2 boy. And back when he was diagnosed, and many of our adult, SMA individuals like Rustam, when they were diagnosed, there was nothing in India. And the picture that the doctors portrayed was kind of very, grimy, because it also comes from the individual experience. So it was like, go love your child. There's nothing much you can do. But fortunately, I come from family of doctors. My sister is a gynecologist. My brother-in-law is a neonatologist, and my brother lives in US. So I was able to visit the Cure SMA US conference in 2014, and there I saw Cure SMA, the international organization, what they are doing. And moreover, I met with individuals who were living their life to the fullest, despite whatever challenges that we have. They were lawyers, doctors doing much better. So it gave us hope that, if there is something like this for the adults and children in India, there can be, a good life, a quality of life can be improved. So we came back to India and started with a Facebook page of hardly 4 or 5 families initially. And on that, Facebook page, as Dr. Hita was also saying, we got to meet five mothers or five of our soul sisters. Today we are five mothers from different location of our in the country and running this Pan India organization. And we have people like Rustam, Karan, there are many, such wonderful SMA individuals who have done amazingly, phenomenally well in their field and who are inspiring us to do better. I would also like to acknowledge Dr. Alpna Kondekar, Dr. Taral, Dr. Mona, to Dr. Hitav and many more. Today we have Dr. Vinny, Dr. Nirmal, Dr. Abhishek to join us and collaborate in this initiative, because it is, also the support from these exceptionally compassionate doctors that we have been able to achieve whatever little we could do. Through Cure SMA Foundation of India, basically what we tried to do is get all these stakeholders together. Our internal stakeholders, which were our families, patients, parents, caregivers with SMA, and our external stakeholder, which is the government, the pharmaceutical, the insurance companies, the healthcare professionals, together on a single platform, so that our vision is to create a robust infrastructure, a robust ecosystem for SMA families in India. And that's where these initiatives as Sathi, the name itself is so apt and it's so heart touching. I can't thank you all enough. We also have something called knowledge series, and once it is translated in different language, we would love to be part of all the resource sharing, because this can help. We are a pan India organization with more than 1800 plus patients registered with us, and the number is much more higher. So this will help immensely to all the patients. So thanks once again on the behalf of entire SMA community. Please accept our heartfelt gratitude for having this wonderful initiative. Thank you. Thanks a lot.
Thank you, Alpna Sharma, and it is a wonderful, story to hear, and it will definitely inspire many of others that from nowhere how you are able to bring this right on the top. And IFNR has been happy that we started the public forum in 2018 World Congress in Neuro Rehab, and it is 8 years that we have been constantly involved with various organizations dealing with neurological disability and bringing them together, because we believe that that neurodisability is one. It has an umbrella of like SMA or epilepsy or multiple sclerosis or TBI or a spinal cord injury. So we all need to come together for bare minimum need for a disabled person across the country. And this IFNR Sati initiation with individual disease, what we are, though under one umbrella, we would want, like as Cure SMA, to be part of SMA support. Similarly, every disease when we are dealing, we will have the patient support group as a partner, so that the information what we provide reaches out to the people who need it the most. And that is our mission, and that is my vision and my team's vision. And I'm pretty sure when the two visions are correct, we always see the whole world with proper vision. So with that note, please, I request Ethan now to take it forward, please.
So before wasting more time, the patients are over here and all the caregivers are over here to listen to the experts. So I would request Alpna ma'am to do the first round of questions. So we have 2 or 3 rounds of questions. These questions have been collated from the patients themselves and have been put forward to the professionals here. And it's an open ground, so they're going to listen to you and agree to you, not agree to you. It's going to be a part and parcel of life. So Alpna ma'am is going to do the first round of questions and I'll do the next round of questions. So Alpna ma'am, over to you, please.
Yeah, thank you. Thanks again, Dr. Hitav. And once again, greetings to you all. And as Dr. Hitav said, that we have a warm greeting to all my SMA family, the SMA members and caregivers. We have in the audiences from all across the country, and these are the patients and the families who are kind of looking forward to you all, and we are again grateful for this wonderful initiative. So my first question is to Dr. Vinny Jason. Uh, One of the parent has asked, and we can take it as a general question as well, that my child has just been diagnosed with SMA, and what does the type, like there are type 1, type 2, type 3, actually means, and how things will progress for the child?
So thank you for that question. Am I audible?
Yes, sir.
Yeah. So see, SMA is of various types, and that depends essentially on at what age have you started to detect that the child is having a problem. So type 1s are patients who before 6 months of age itself, you're starting to notice that they are having delayed milestones. They're not having head holding. They're not able to move their limbs as much, especially the lower limbs. Then you start to say that, okay, this is probably a type 1 SMA. Type 2 SMAs are children who beyond 6 months, they were normal. But after 6 months, then they start noticing maybe at 8 months or 7 months, anytime between 8 to 18 months, when we start noticing that this child is not actually attaining sitting, this child is not moving properly, he is weak or she is weak. And then the type 3s are who are normal even up to 18 months of age. There's absolutely nothing wrong with them. And beyond 18 months, after they are maybe 2 years of age or older than that, then we start noticing that they have weakness. Why is this important? This is important in terms of long-term outcome. Obviously, the children who are picked up earlier actually have much more severe weakness. And because of severe weakness, they develop respiratory problems, they develop spine problems. That doesn't mean that these children can't survive. It just means that they will be much more severely affected. And that's where treatment becomes so much more important in them. I'm sure we'll discuss treatment later on. But it depends at what age your child was diagnosed with SMA. That is very important. More important, when did you notice that this child was having problems? So those are some clues which can tell you between type 1, type 2, and type 3 SMA.
Thank you. Thanks a lot, sir. That was quite informative. And yes, we will have a lot of questions on treatment because SMA is one of the few neurological condition with now definitive treatment and treatment that has, proven outcomes too. So thank you. Thanks a lot. So my next question is Dr. Alpna Kondekar. Ma'am is also, she is, extremely supportive in all our SMA initiative. She's part of our task force team and scientific advisory board and has been holding free SMA clinic, the clinic at Nair Hospital. And that has been immensely helpful for the children and teenagers with SMA. So ma'am, the question is that 5-year-old SMA baby has taken Zolgen SMA gene therapy last August, and they're not seeing any neck control even after 1 year. By the time actually the child took the gene therapy, the child was almost 2 years, but around 7th month itself, the hands and legs movement were down. So, is there any bone related issue that they may have, or can there be any other medication that can help the condition?
Oh, okay. Thank you, Alpana, for that question. And here, first of all, I want to point out that since the symptoms have started much earlier, and at 7 months only they have noticed all these issues. That means, as Dr. Vinit said, the symptoms have started early. This could be a type 1. Type 1 means a more severe form, right? So, in more this clinically severe form, usually these children has very rapid deterioration and complication which comes up very early. Now the question is of gene therapy. Gene therapy usually we suggest that it has to be given before 2 years. Now why do we say like this? For any kind of treatment that is available for SMA, it is very, very important principle is you start when the child is pre-symptomatic. Now it's very difficult in our country because diagnosis only is happening so late and then access to the treatment is also delayed. But if we start any kind of treatment before the symptoms, or maybe there are some mild symptoms, it is more useful. Now, gene therapy, this child received after 2 years. So by that time, already there was a significant loss of motor neuron. So in this position, the expected improvement is little guarded. We will not say that the gene therapy has failed, but whatever motor neuron loss has already happened will not be replaced even after the gene therapy. So that is one point. Second point is it is not only the disease modifying treatment, but other supportive treatment also matters in the children. So if this child has noticed that some symptoms which are there, still head holding is not there, severe muscular weakness is still there, we have to also look for other factors which will aggravate the muscle weakness. Now, definitely muscle weakness is there, truncal and neck control is not good. So we have to first see which are the correctable things here we can assess and help the child. For example, nutrition, the bone health, whether there is any osteopenia, whether there are any small fractures which are going unnoticed. So these points are also very important if the child is yet not having any head control and showing any deterioration in the symptoms. Now, regarding the combination therapy, the child has already received gene therapy. And if this child we can support with additional therapy with either risdiplam or nusinersen, uh, the effectiveness of combination therapy has been studied, but definitely the advantage is always there when you do this when the symptoms are less or no symptoms are there. Combination therapy, if available, or if we can give any continuation therapy with risdiplam or nusinersen, we should go ahead. But the motor neuron loss, which has already occurred, will be definitely difficult to gain again. We can maintain the child for whatever level the child is right now. I hope that answers the query.
Yes. Thank you. Thanks a lot, ma'am. That was, quite informative. And so my next question is to Dr. Taral Nagda. Again, sir has been one of the gems, I would say. He has been holding free SMA consultations and surgeries, doing free surgeries for SMA patients, children, and very, very supportive and compassionate to us. We would need much more, such supportive, all the doctors to come forward and help these children. So thank you, sir. The question is, SMA is a neurological disorder. How is a pediatric orthopedic surgeon relevant to management and care of a SMA child?
Yeah, so Alpana, thanks for that introduction. But the nervous system and bone, it goes hand in hand. It goes hand in hand from the time the embryo is formed, the child is developed, the child learns to sit, stand. The bone development and neurological function goes hand in hand. So if anything goes wrong with the neurological function, bones will be affected. There are 4 areas in which orthopedic systems get affected in a child with SMA. One is, as Alpana, there are 2 Alpanas, but Alpana, who is a neurologist, as she suggested, a lot of these children get scoliosis. A lot of children also get affection of the hips. So that's the second most common problem. The third problem is contractures and deformities. And the fourth problem we get is, reduction in the bone quality, what we call it as osteopenia. So these are 4 major problems which we see in children with SMA. And why do they happen? They happen because there is muscle weakness, there is muscle imbalance that will lead to reduced function. And when that happens, along with growth of the child and gravity playing role, you get spine which is not aligned, then you get scoliosis, the hips which change their angulation, change their rotation, they go out of the socket, and then you get hip dislocations. You get muscles which are more powerful. They will move the joint in that direction, and with persistent sort of a posturing, you get contractures. As in case of Aro, he got genu valgum because effect of muscles on the bone, the bones get deformed, and then you get deformities such as genu valgum and other deformities. And lastly, you get decrease in bone mass, what is known as osteopenia, and you can have frequent fractures and bone pains. So I would say that neurology is the origin, but the orthopedics is consequence in SMA, and orthopedic surgeon has a major role to play in care of children with SMA.
Absolutely, sir. Can't agree more. Orthopedic surgeons have a vital role. We have nowadays so many SMA adults who are having complications because initially we didn't had all these services. So I think Rustam will agree to this. And so thanks a lot for the wonderful explanation, sir. So my next question is to Dr. Mona Patel. Mona ji has been integral part of our journey as a mother to SMA child RF. She was our, RF's physiotherapist and first therapist, not just RFs, I would say for all of us, the entire family, and now to the entire Cure SMA India. She has been there along with her Dr. Tejas, has been, kind of, both of them are integral part of our journey, helping today all the SMA families across the country. So thank you. Thanks a lot, Mona ji. And my question to you is a 3-year-old SMA type 1 baby with no neck control is on tracheostomy, BiPAP, and G-tube feeding. We find it difficult to take her to hospital since we can't find any lightweight stroller or wheelchair to transport her in a sleeping position. Any suggestion for her mobility considering no neck control? Also, we don't know whether regular physiotherapists can handle these kind of babies and whether any bed is available to support the physiotherapy for such infants.
So, what is important? I will simplify this. When you have a non-sitter with no head and trunk control and then has respiratory and GI issues as well, what is important is we need a right kind of transfer system. Now, the systems which are available, what you need to see as a parent. So there are two things. One is how much recline and how much tilt in space. Tilt in space is the orientation related to gravity, and recline is how much back is tilted with the sitting. So we need to see, we need to carefully select that based on the type of control our kid has in terms of how much they can sustain the anti-gravity posture, even in a reclined position. Because when the child is on ventilator, we also need to see with gravity coming in the effect, whether hemodynamically he stays stable or not. So for that, what we need is that the child, as soon as he comes in the environment of gravity, he doesn't get compressed. So we need right kind of pelvic support, right kind of trunk support, right kind of head neck support. So usually a lot of the sitting systems has a degree of tilt in space as well as recline, but it also has a head support usually in occipit, like a back of the head and the side. But sometimes you need anterior support also. So if with recline and tilt in space, if the child stays stable, you can put the systems either in a stroller or a tilt in space wheelchair. And if the child doesn't stay stable with vertical or semi-vertical positions, then you need a stretcher kind of thing, a lying kind of a system. So there are different, obviously in India, the wheelchairs which has this kind of adjustments are limited, but now more and more providers are sensitized and they are working towards it, so we can create it. But now the parent need to get educated about it, and they need to understand, and they need to take right kind of advice from the medical and the therapist team, and then they need to choose the correct equipment.
Thank you. Thanks a lot, Dr. Mona, for the wonderful explanation.
Okay.
So my next question is to Dr. Sharuja. What simple changes at home or school can make daily tasks like eating, dressing, or writing easier for a SMA child?
Yeah, hi. Thank you very much. Thank you very much for this
Hello, ma'am.
question. Yeah, am I audible? I'm sorry,
Yes.
I'm traveling.
No, thanks for joining. You are audible, ma'am.
Yeah. So when we talk about making daily activities easier for our children with SMA, we should not look at only the physical aspect of it, but rather we should ask how can we make that child want to participate. So children are much more likely to engage when an activity feels like a play rather than a task. So instead of simply asking a child to practice certain skills such as eating, dressing, or writing, we should build these skills activities they enjoy. Example, cooking a simple recipe together. This can naturally involve reaching, stirring, pouring, or using utensils. Uh, Pottery, clay, all these things encourages hand use, creativity, dressing a doll, setting up a pretend restaurant, drawing a favorite character. So these playing games practices makes these activities more meaningful. So what I would do majorly is how can I make that child want to participate rather than just doing a task. So, and the first thing what I work upon is positioning before equipment. So, a stable trunk, supporting the feet, supported elbows, this makes the huge difference. So we can use handles which are lightweighted, sometimes supporting forearm. That creates the more impact. So example, child may eat first few bites independently, but later that task becomes little exhausting. So that time giving forearm supports. So those thing makes it more easier. Even when it comes to the dressing, we can have velcros, so that elastic waistbands. So these modification makes them feel more participating. And if you in the school, we can use the tablet, we can use keyboards or short rest breaks. So these kind of a support that makes them feel more participating. So those kind of a modifications which I would suggest.
Thank you. Thanks a lot, ma'am. Yes, adaptive sitting arrangement, adaptive clothing, and all these things are blessings for our
Yes.
children. Thank you.
Yes. Thank you.
So my next question is to Dr. Brashuti. How do we talk to our child about their condition in an age-appropriate way without scaring them or making them feel different?
Hello, hi, am I audible?
Yes, ma'am.
Okay, thank you. Thank you for that question. So I think firstly, having said that you have to disclose this to your child is very important. So having said that, while you are disclosing to your child, it is important that you make it very simple and tell them that maybe you know that your muscles are a little weaker, so you need little more help with it. Maybe the tasks are difficult for you. However, telling them and equipping them is very important. Sometimes many people do hide the diagnosis from the patient. So, when you hide that, automatically the guilt, the shame, everything comes in. But when you tell them that no, this is what you are going through, and maybe when they are asked the question about that, they can also tell the same thing. So, basically, they are taking the ownership of whatever they are going through, and we don't want to label the child as a SMA child. Rather, the child is living with the condition of SMA. However, there are other abilities, other creativities, or whatever they are good at. After we have told them about SMA, it is very important that while we are telling them or while we are explaining this to anyone else, we ourselves are comfortable. If we are not comfortable, they might think that, see, because of me they are not feeling good, because of me they have to go through all of this. So it's very very important how you are portraying that. And likely, as and when you feel that the child is going through any emotion or he's having some negative consequences about it, then you can also address that. But it's good to do it at home rather than taking it outside where they become uncomfortable. I hope I've answered the question.
Yeah, thank you. Thanks a lot, Dr. Rishite. This is one of the most difficult part as a parent that anyone faces, because every child is different, and we don't want to demoralize them, but at the same time understanding the reality is also important. So thank you. Thanks a lot. So my next question is to Dr. Pavitra. My child has troubled swallowing sometime. How do we know that it's normal feeding issue or something SMA related that needs intervention?
Okay. Thank you so much for that question. Am I audible?
Yes, yes, ma'am, you are.
Yes. So right now, when we are seeing children with SMA, like it depends upon the patterns of what kind of feeding difficulties they have. So when we ask in general, like what kind of difficulties, they just say that the baby is not able to have a full meal time. The child is having a lot of choking episodes. The child has a lot of different patterns which they start explaining. So when we take a proactive assessments with clinical and we observe the pattern of eating, there are very standpoints that you see. There are a lot of predisposing factors that the child will actually portray when they are having. So already set in oromotor weaknesses, They would have a lot of trunk and head and trunk positioning issues. They will have a lot of difficulties when you give them a meal time, and initially they will be okay. When they come to end of the meal, because of the fatigue that sets in, they start choking, they start coughing, and at the end of the end of the meal time, they would have episodes of aspirations as well, where there's a lot of panicking around at that certain time, and the child is being put for a meal time. So understanding and taking a clear cut detailed history helps a lot. So when we're understanding this, it's important that we are not just evaluating them and making sure that it's just a swallowing feeding difficulties, or are they having higher risk of aspirations and associated pneumonias, which becomes more recurrent in them. So understanding what kind of difficulties they have, and how much episodes of respiratory distress they've had, all of that gives us an information that it is more neuromuscular related, and the child has more of neurological involvement, which is affecting their bulbar severities more, because of which the child is aspirating and have more episodes of choking episodes that is not very safe for the child to have food. So that is where we try to evaluate the different consistencies of food, understand is the child really safe to have per oral intake, or do we have to put the child on any enteral tube feedings, so that will help the child to gain the nutritional support and help them thrive better. So we do run through a lot of instrumental evaluations like fluoroscopies and endoscopic evaluation, which will help us understand, is this child's airway safe? Does the child have any airway protective mechanisms that is safeguarding the child to have the per oral intake, or should we actually take off the child from per oral intake and try to supplement it with some other enteral tube feeding till there is some amount of risk that can be channelized better. So understanding it is SMA based will be all based on the patterns, and the fatigue is something that I usually see in most of our children. So, and taking a good amount of history and understanding the biomechanics. So sometimes it will just be just a small, simple posture correction that will help the child to have a safe swallow. So sometimes when you just correct, when you're talking to the caregivers or the parents and you tell them, can we have the child prepped up in this position, or some kind of swallow strategies, a simple swallow strategies itself will ease the child to have a better safe swallow. So when you sit down and talk to them, patterns concerning to swallow becomes one of the challenging things that we have seen, and it helps us to easily diagnose that it's neuromuscular based on the regular feeding patterns.
Thank you. Thanks a lot, Dr. Pavitra. You have explained this very well. So my next question is to Dr. Sorry, this is to Rustam, our loudest and strongest advocate for SMA. So thanks, Rustam, for joining and for
My pleasure, Alpana.
doing what you are doing for the entire
Yes.
community. From your own experience, what's one thing you wish doctor had told you and your family right after the diagnosis?
Well, like most of the insight has already been given by a lot of you guys. The one thing that you asked Ms. Vrishti, like how do you tell a child, and that is what used to be the case in the past. Like if a child is less than 15 years old, like I was 13 when the doctors at the Mayo Clinic first explained what I was actually suffering from. Before that, I had no clue. And the one thing that they initially didn't want to do is because they thought that they would not be able to communicate what is wrong with me directly with me. They wanted to speak to my parents. And then I insisted. I was there because my parents were actually younger than what age I am right now. So they were actually in their 30s when the doctor explained to them, and I insisted to be there because I could speak better English than them and I could communicate much better with them. The one thing that
That's our SMA children.
yeah,
So
exactly.
cognitively
And
so
you know it
bright.
better than I do.
No.
And the one thing about doctors, I think this is the problem today itself. A lot of parents go in with an expectation to a neurologist or any doctor for that matter, looking for a cure. Oh, there are दवाई है तो ठीक हो जाएगा ना, चलने लगेगा ना. And I think the very first thing that, and which is why I'm happy in a sense that, a lot of the doctors, when I was growing up, when there were no treatment options available, insisted a lot on risk assessment in terms of if your child is severely at the risk of falls, even though he is able to walk and is ambulatory, contain that ambulation to a very safe environment. For other environments which are unpredictable, get him a wheelchair. There's no taboo, there's no harm. The whole point of making sure that the child doesn't go through any risky element is to prevent regression. Because I myself am proof of the fact that when I was 9, I met with a bike accident, which left me with a broken tibia and a femur, and I was bedridden for 9 months. I went from depending on an AFO to then going to a complete HKFO setup to then finally progressing onto a wheelchair. And nobody told me this is what would happen. And that is one thing. The other major thing is like, a lot of doctors, they fail to tell the parent, this is a bloody complex. Any chronic neurological condition is complex. No two SMA people are going to have the same lifestyle. No two SMA people are going to need the same kind of interventions, the same kind of multidisciplinary approach. My scoliosis and how it affects me is so different than how it would affect an Arav, how it would affect a Karan. Dr. Nagra correctly put it, like neurological conditions, neurological, regression, a progressiveness of it will actually affect a lot of your bone structure, but that doesn't necessarily have to be the same. Like I would undergo it very differently based on my nutrition, my genetic makeup, the kind of diet that I go through, the kind of lifestyle that I lead, the kind of devices that I use. Like, and parents go in expecting there's a one size fits all template. So type 1 है तो सब type 1 babies ऐसे ही होंगे, type 2 है तो they will naturally be like this, and type 3 है तो वो तो मतलब like they will live well into their 30s and 40s. And so what happens is that misconception kind of gets ingrained and conditioned to actually the patient's own life, where, oh, he's a type 3, so iska progression to itna severe nahi hoga, so we might as well wait a bit. He's okay to eat like, the way he wants. It's okay. So there was a phase of my life where I was studying in the US. I was studying filmmaking, where I had no physiotherapy or intervention for almost, I would say, close to 17 years. I was so confident in my own strength. And like, even though the progression was so minimal, by the time I realized that it had gone beyond a point where I had lost so much of my ability, it was too late. And now, after another wake-up call back in 2019, when I fractured my meniscus and broke my knee in 19 different places, that was the biggest wake-up call in my life. I had to lose weight. I had to figure out how to get semi-ambulatory. I had to figure out how to get my core back. I had to figure out how to be able to sit unassisted, even though I'm like a type 2, type 3 hybrid, and this is what nobody prepared me for. This is what no doctors told me. Like, they just tell you, oh, you're a type 3, it's not so severe. You can like, so this is not the case. Like, you need multidisciplinary approaches. You need to have the right system in place. And honestly, over the last 32, 33 years, I have become my own doctor. I know a lot about anatomy and physiology and diet and like, I have to become my own counselor in that sense. I did psychology for 2 years as my arts major. I had to learn all the skills on my own. Like, I had to learn when to surrender. I had to learn when to accept. I had to learn when to find knowledge resources on my own till I was introduced to Cure SMA and the fantastic work. And today, again, like I told Dr. Surya earlier on, like, this is pleasantly shocking, and I'm absolutely amazed that we now have something like this, which is going to, in a way, you know it better than I do, Alpana, a lot of the problems and complexities, and I would say naturally even headaches that we face with a lot of parents like bombarding us with the same questions time and again. And now we have a resource like this where 80% of the basic questions that you and I, as part of Cure SMA, are being asked constantly by a lot of desperate, hopeful parents and patients are going to be answered by a platform like this. And like, this takes so much of the onus from actually like, going back to the basics and trying to, again, explain to them. And we can directly get to the core of, okay, now that you know what your kid is suffering from, now that you know what is needed, what is it specifically that you need? And this is what I face even when I go to physio today. I see a lot of MS patients, I see a lot of DMD patients, and then I see like, how the kind of devices they use, the kind of postural support they might need, and the physio is trying their best, but then that communication, when it happens, I am being called from my session to actually talk to that parent, even though it's not a non-SMA patient. I actually have to, because they realize that I have been through an entire phase of having experienced life in India and abroad, and I know exactly like, where's that bridge and where's that connection. And I think that communication is so key. It's just telling them, okay, let's not think of the future, let's not think of the past. Tell me currently what are the things that you require. Like, what is the most difficult task at hand? And 90% of the time, it's something as simple as transfers that we have spoken about. And 90% of the time is like, the child starving himself deliberately, or the parents not feeding the child enough, thinking that if he puts on weight, it's going to be difficult. without realizing that the correct kind of nutrition actually will help him better than it's more detrimental. So it's the small things, and this is great. So yeah, over to you.
Thank you. Thanks a lot, Rustam. So that's, you spoke what was kind of, has been going through all the SMA individuals and the caregivers are facing. So I would just like to add one thing that, it's also today we have Rustam. Today we have Anushka, Pratyush, Karan, so many of these SMA individuals who are exceptionally talented. SMA doesn't affect cognitive ability. So, to all the attendees, my just humble request is that tell the child that they are going to have a beautiful life because we have with us my soul sister and co-founder Archana, Sri Lakshmi. I'm grateful to have met them. They are mother of children who an adult with SMA who have done exceedingly well. Pratyush is working with Google, Anushka is working with Microsoft, Karan is a canine behavioral trainer, Rustam, we all have heard how inspiring he is. So this gives us hope, and we all need the hope to live. And having a centralized resource like, Sarthi, can't thank enough to Dr. Nirmal, Dr. Hitav, and all of you at IFNR to have this, centralized resource where the parents can actually gain the knowledge and for the knowledge sharing. So I would like now invite Dr. Hitav for the second round of question. Thank you. Thanks a lot.
Yes, ma'am. So, before we start with the next round of questions, Dr. Surya, would you like to say a few words before we go ahead?
I think it was extremely, eye-opening for many of us because, as story told by Rustam and by the Alpna, that what was the situation 10 years ago and 15 years ago. Unfortunately, 15 years ago, IFNR was not there. We only found in 2012. And I think people would thank us that we now all come together to take this forward. I think we all the time look at the government that, the government will do it, the society, but we don't take initiation. And when the patient and caregiver, they take the initiation, you would think that, where you can reach. Many time, person think that I am suffering, what can I do? I only have to look at doctor. And their doctors are so busy that they don't even have time to explain many time. And let me be honest, how often we see a patient with SMA? Maybe once in 6 months or once in a year. So are we really that capable to answer all the question when we see a patient once in a year or once in 6 months? So these are the real questions and challenges. And I'm sure Vinith will, now that in last 10 years or 5 years, when there are specialized centers are opening, rare diseases, things are changing, the number of neurologists are increasing. So this is the right time and opportunity. I think if you have disease, you should have a disease when everything else is available to you so that you can take maximum benefit of you. Not that when disease is there and you don't have, like today MS, you got 20 treatment available. But I know that I have lost the patient in 90s and 2000 who could not do anything. So yes, we are, understand what you have faced through, and that has made you so strong that you came forward to build this organization and take others that what you have suffered, they should not suffer. So thank you very much for allowing us to come together and using this platform of IFNR, which should become a uniform platform for any person with disability across the globe. Thank you, Hitab.
Thank you so much, sir. Dr. Abhishek, sir, do you want to add some light before we go to the next round of questions, please? I think Abhishek sir is there's some issue. Once sir joins, then we will ask him his views about this. So coming to the next round of questions. So again, my question to Dr. Vineet. Sir, how has the introduction of disease modifying therapies changed long-term prognosis expectations? And with the new SMA drugs available now, how do we know which treatment is right And how soon after diagnosis do we need to start these therapies, sir?
Okay, so just to tell you, we know that SMA, I'm audible, I hope. Yeah.
Yes, sir.
So SMA is a disease of the anterior horn cells, which is basically in the spinal cord. And SMA, basically, there are two important proteins we should know, SMN1 and SMN2. Both are good. SMN1 is the main protein that is important when the child is growing up and those anterior horn cells are forming. So, which is what is missing in all SMA patients. None of the SMA patients have SMN1 protein. So that's the first point. The second point is SMN2 protein is the protein which is there in variable levels in patients with SMA, and that causes the phenotypic or the expression to be different. In the sense, some will be type 1, some will be type 2, some will be type 3, depending on how much and the quality of the SMN2 protein. So the treatments that have come are basically one to replace SMN1 protein, which is missing in all SMA patients. And the second type of treatments have come to increase the expression of SMN2 protein. I hope that is very important to understand. And the diseases or the drugs that we call them is onasemnogene, which is basically the drug, one-time injection in a virus that is given to patients under 2 years of age. And that has the SMN1 protein which gets replaced. So that is the drug that everybody would like and extremely expensive. And it's a one-time infusion below 2 years of age. The other two treatments are nusinersen and risdiplam. Nusinersen is basically an intrathecal injection, which also increases the production or the expression of SMN2. Risdiplam is an oral drug which was initially given as syrup. Now there are tablets also that have been approved for risdiplam, where we will be able to increase the expression of SMN2 just by taking the medications. The field of SMA has changed dramatically after the introduction of these drugs. Those patients who were given SMA type 1 patients who would have been picked up before 6 months of age, and 90% of them without treatment would not live beyond 2 years of life, till now are surviving. Now, when were they given these drugs? They were given these drugs in 2016, 2014, 2016. The initial trials where these patients were given are all being followed up. They're still surviving. Although some of them are all of them are ventilator free. Some of them are requiring feeding by, NG feeds or through PEG, but otherwise they're pretty good. Now, these are only 13 patients I'm talking about. So we have that data available to us. Some of them are also supplementing them. They all got onasemnogene, but they are supplementing themselves with risdiplam or nusinersen. That being said, this is remarkable in a field where we knew 90% of these children would not live beyond 2 years of age. And similar things can be said in SMN type 2 as well as SMN type 3. Of course, in those patients, we don't give onasemnogene because below 2 years, not many are diagnosed. So they get risdiplam or nusinersen. Even in them, there are good results that are seen in these patients. One thing that I would like to also bring to notice is that, see, SMN we thought was a pure motor disease, but we know now it is no longer true. The SMN protein is expressed in other tissues as well. In the pancreas, you have it in the bones, it causes osteopenia. There are other organ systems also that get affected. So as these children are now growing older, SMA type 1s, as they're growing older, it is more important that they be part of a multidisciplinary care program where all of these diseases can be diagnosed timely and intervened. But it is a wonderful time. It's a wonderful period for people with SMA where there is hope. And there are even more newer drugs which are coming in. Anti-myostatin drugs are coming in, which can also add further to the quality of life of our children.
Thank you so much, sir, for that Sure. For that explanation that you've given to the question, and I think all our parents are going to take that forward. That when a doctor tells you not to take the therapy, he is not stopping you from taking it. There is a scientific reason why some are being told to do gene therapy and some have been told to do Spinraza or Risdiplam or any other medication for that matter. Thank you, sir. So now coming to our very own Dr. Alpana Madam, I'm proud to say that I'm a part of Madam's MDT clinic at Nair Hospital. So Madam, now once as a pediatric neurologist, you have diagnosed a patient. What do you want the parents to tell their regular pediatricians, or what should regular pediatricians check when the baby comes to them, ma'am?
Okay, it's a very good question. Uh, it is said by Dr. Vinit that now SMN1 is also expressed, is found that it is also expressed in other systems. The comorbidities which are there in SMA patients are much more. And when the disease actually start progressing, the patient come with multiple issues. So whenever the diagnosis is done, there are two, three important advice that we give to the parents. First of all, with the diagnosis, after explaining the diagnosis and the clinical history of the disease, usually there is a very strong denial, there is a strong sense of frustration. So parents actually need some support. So we do have in our center the palliative care and counselor to whom we refer. Once the parents are explained about the complete availability of the disease modifying drug, how to access, how to mobilize, how to procure, and if the child is affording is already started on treatment, the follow-up schedule is given. Now in multidisciplinary team, uh, there are pediatric neurologist, orthopedic surgeon, pulmonologist, endocrinologist, as well as the therapy expert where physiotherapist, occupational therapist, speech therapist, genetic counselor makes the whole team, which is functional in the NIR also. Now, if somebody who is not able to attend to the special care OPD where all these consultations are available, and depending upon the child's need, we refer them to the team member on the same day to show and to talk about their issues and manage their issues. If the if it is not possible for the parents to visit the multidisciplinary team for various reasons, maybe they are coming from very far place or very interior place where all this accessibility is less, because as it is in India we have hardly 10 to 11 such specialized center. So to pediatrician we will request that multidisciplinary points which they should assess. One is the motor examination. So the motor milestones, charting of motor milestones, and apart from charting of motor milestone, overall presence of the muscle strength, contractures, the fatigability should be listed in each follow-up. For respiratory health, the pediatrician should concentrate on the cough effectiveness, whether the child has any chest congestion, recurrent respiratory infections. And these recurrent respiratory infection can be prevented with simple maneuvers. Uh, Airway clearance has to be checked, and the swallowing issues. If the child, especially type 1 or those who are non-seater, they come with feeding difficulties and swallowing issues. So they have to be referred to swallowing consultant or a speech therapist. Coughing, choking during the feeding is seen in these patients. So there should not be any forceful feeding. They should be observed for silent aspirations. those type 1 children who have poor neck control, simply I heard Hita also telling and advising in our OPD that the simple roll of towel to support the neck really helps during the feeding. These children should be regularly monitored for their nutrition. So every time whenever they visit doctor, there should be a record of weight, height, length, calculation of BMI, and the growth trajectory has to be regularly and frequently monitored on the growth chart. That is very important because too much of weight gain also a kind of malnutrition. So there should not be undernutrition as well as obesity. Most of the children we have seen also suffering from constipation, reflux, and abdominal distension, which affect their feeding. So that has to be checked. The constipation has to be treated on regular basis. Regarding the bone health, vitamin D status and calcium levels need to be monitored, and the children should be on supplements on the regular basis. For orthopedic comorbidity, the hip screening and spine screening has to be done. So having these X-rays looking for the hip displacement is very important. And accordingly, the child should be referred. If they visit to multidisciplinary team, definitely all these things will be done under one roof by the experts. But if it is not possible, at least these points has to be taken in consideration. And the very important point in pediatric patient not to miss is the vaccination and immunization, because routine immunization, especially now government has also included pneumococcal vaccination. So routine immunization is equally important. And apart from pneumococcal vaccination, we do advise for some optional vaccines like varicella vaccine, because the complication of varicella also are bad. Even simple measles vaccination is very important, because post measles these children can have immunosuppression, pneumonias like complication, and annual flu vaccine. So the story doesn't end over here. If in a family one child is suffering from SMA, it is important to have the carrier screening for the other siblings, as well as if there is any sibling or relative marriageable age, the close relative, then definitely screening as well as prenatal counseling is important. So it is multi-pronged approach, and lot many these factors are there which are other than the disease modifying drug. Because what we see usually that patients are very much like dependent only on the medications, and they tend to ignore all these points which are very important to improve the quality of life in these children. In fact, I would say that there are many children who are following up with us on regular basis. They are not on disease modifying drugs because of the lack of accessibility and affordability, but because of the regular follow-up, regular therapy, and regular screening, they are really maintained well. So it is very important from improving the quality of life, and I will advise all these follow-up for the children. Thank you.
Thank you so much, ma'am. So, coming to the next question to the orthopedic surgeon over here, sir. Sir, in your previous question, you spoke about orthopedic issues in SMA. So, do you think are they preventable? And if yes or no, how can associations like the Cure SMA India and IFNR do to increase awareness about the prevention of these orthopedic issues, sir?
That's a right question, because I am part of both the organizations, and I can, talk for both of them working together. Few important points. Vinit spoke very well, Alpana spoke very well about the disease modifying therapy, improving survival and improving motor and functional outcome, especially with early treatment and early diagnosis. That's a good news. But the bad news is that the disease modifying therapies do not eliminate musculoskeletal consequences. It's not that you've given DMT to a child, his function has improved, survival has improved, but they still keep on getting scoliosis. That doesn't get eliminated. In fact, Delphi's study, which was done in 2026, said that the hip and the spine issues continue and they continue to highlight. Okay. So now what is happening is, since we know that with advent of DMT, a hip issue with a bilateral hip dislocation would not matter much because child did not have good function or had poor survival suddenly becomes important, because this child is going to survive and also be able to stand and take few steps. So we need to address the spines, the hips, the bone health and the contracture. And that's why the orthopedic care, there is a shift. There is a shift from damage control to proactive surveillance and preservation of motor potential. And this is something very, very important. So from treating a person who has an accident, we are talking about accident prevention. And this is something, which is completely game changer. And how do we do that? As Alpana spoke in in the previous speech, uh, orthopedics also becomes a part of the team, and every year annually, even if the child does not have orthopedic symptoms, there should be a orthopedic surveillance. And same thing goes for various other systems, the respiratory, speech, OT, PT, everyone should be seeing these children, and if possible together. Okay. The second issue is that early intervention, early therapy, early splinting can prevent a lot of problems which require surgery later on. Now coming to this, the issue is India is a huge country. They say that every sixth person is an Indian. And if we extrapolate that, every sixth patient in the world is an Indian of SMA. Okay, so we are a huge country and huge number of patients with SMA. And we need to come together because, with IFNR and Cure SMA India coming together today, this function has happened, where so many people have joined together. We are exchanging ideas. The IFNR Sathi is happening, where we are talking about patient advocacy. So it's not dawa, which Alpana you supply, or it's not just dua, the blessing. It's also diya, which is enlightening the parents and making them more empowered. More than that, we have so many other roles to play. Special sessions in conferences, professional, teaching program, training programs, and most importantly, research. I think in next 10 years, every article on SMA guidelines, which people will refer to, should come from our country, and we should not be looking at something which is published abroad. So I think IFNR and Cure SMA has a big role to play. Though Dr. Surya did mention that SMA is not a very common condition, but because now there is a cure available, and because a lot of people with SMA are going to survive, it becomes a public health problem, and we need to make noise about it. And this noise, one person makes a sound. When two people talk, it's a noise. So that's why it's important that two organizations come together and makes this noise. Thanks, Ito.
Thank you so much, sir. And maybe we'll just take this forward and make it a reality someday. And not someday, within the next 1 year. And we can get that. And now my next question goes to a dynamic physiotherapist, Dr. Mona Patel, who's here. What is the realistic goal of physiotherapy for a child who's non-ambulatory? A lot of times it is either walking or wheelchair. Do you see that? Are they two different, or do we have to use both together, ma'am? So, what's your realistic goal for a physiotherapy child, for a non ambulatory child? And is it walking or is it a wheelchair use completely, ma'am?
So, I always say that it's important that we first understand where the child is. So, as we rightly know that there are classification which gives them into three types: non-sitter, sitter, and ambulatory. When we talk about non-ambulatory, we need to see whether the child is non-sitter or sitter. And as we all discussed today, that with disease-modifying therapies, now these kids are surviving, and uh, and even the SMA type 1 kids, when they receive it pretty early, they are also walking. We are treating such kids in our clinics today. So it's important that we understand and we support them at the level they are. So the answer to this specific question is, where is the child currently? What is the level of control the child has, especially at what level he has received the disease modifying therapy? And depending on that, we need to design, or we need to support, educate, and make the program for parents. So for example, if the child is sitter and uh, and has received disease modifying therapy, we need to understand that first we prevent or delay the contractures and deformities as much as possible. And that's when I always tell parents that even if we need to select the right kind of wheelchair for the child who is sitter, we need to make sure that we practice passive standing, because that can support the hips, the spine, can delay the scoliosis or the hip complications, as well as flexion deformities and ankle plantar flexion deformities, or it can delay it to certain extent. So passive standing is very important. So very important is that 24 into 7 postural care, also in which position the child spends most of the time, positioning correctly there. Also, as a therapist, we need to teach parents that children with SM, especially non-sitters and sitters, they are fighting against gravity, and they have almost very minimum resource in terms of musculoskeletal strength against gravity. So when we need to work on those muscles, and when we want to optimize the function to whatever level it is possible, we need to help them understand how we can prepare exercises or environment and modify it in a way that there is less gravity or modified gravity, and we work there. So that is very important, and explaining and educating parent about that is very important. Also creating a right kind of understanding that, okay, with disease modifying therapy we want to optimize and improve to certain extent, but before they're maintaining the musculoskeletal health and helping the possible progression is the most important thing. As we know that these children are growing also, so maybe with the disease modifying therapy the progression of the condition comes, but with growth comes weight and height, and so the effect of gravity then increases. So all the parents needs to understand this, and according to this they need to take the decision. So if their goal is sitting, then how we do wheelchair adaptations, how we work around muscles so that we don't develop contracture and deformity, and how we can use mediums like aquatics, like using suspension frames, like taking support of low level electrical stimulations without reaching to the level of fatigue, functional exercises, treadmill support training. So it's very important that we help as a wherever the child is, understanding it correctly and then helping them with this. Thank you.
Thank you so much, ma'am. Now coming to the occupational therapist, Dr. Sharuja, are there specific assistive devices or sitting or wheelchair adaptations we should be asking for the patient as the condition progresses?
Thank you very much for this question, Hita. I would frame this as an evolving conversation and not a one time prescription. Because with disease modifying treatment and changing functional abilities, we shouldn't assume that the equipment only will be needed when the child is getting weaker. Am I audible?
Yes, ma'am, you are audible.
So, I was saying, yes, we shouldn't assume that the equipment will be needed only when the child is getting weaker. Rather, we should reassess in both directions, such as what support is needed now and what new abilities can help the child develop and use. So, when we talk about sitting and posture, a customized sitting can provide a good pelvic and trunk stability, which helps them to manage postural asymmetries. And as the need changes, tilt in space or a recline function, these can provide pressure relief, postural rest. So example, the child may be able to sit independently for 20 to 30 minutes, but he becomes slumped and unable to use his hands effectively. So better sitting, which allows them to continue playing, drawing, interacting, these should be well considered. If I talk about power mobility, we should consider it as early as appropriate, and we shouldn't necessarily wait till the child loses all mobility. Because imagine a child who's a 4 year old who cannot walk across the school campus, but has an excellent cognitive and hand skills. So, a power mobility option can allow that child to move independently, choose where to go, and keep up with his classmates. So, I would say independent movement isn't just a luxury for later. It should support exploration, it should support learning, it should support confidence and social participation. Next, I would go for protecting upper limb functions as much as possible, because this is particularly important as proximal weakness coexist with the distal functions. So, mobile arm supports or overhead suspension system, these can reduce the effort required to lift the arm. So, the child may not have enough shoulder strength to lift their arm to the table. But once that arm is supported, they may be able to color, use the tablet, feed themselves, play a game. So these devices are not just doing the activity for the child, but it is removing the weight of the arm so that child can use the function what they still have. If I talk about environmental access, whenever appropriate, we should consider the switch access, the adapted toys, or the tablet controls. Now, these environmental controls help the child to operate devices, toys more independently. And most important is we should keep reassessing regularly. So, a right equipment today may not be the right equipment after 1 year or 2 years. So, we should look for the fatigue, we should look for the posture, we should look for the comfort, participation, what are the school demands, what are the family routines, and what are the child's own goals. So we are not going to simply planning for a decline, but with modern treatment, we should also plan for participation, preserve their function, make room for new gain, so that our equipment reviews needs to go in both direction, protecting what the child has while creating the opportunity what they can achieve next. Thank you very much.
Thank you so much, ma'am, for that elaborate explanation as to how we can help our children with spinal muscular atrophy. Coming to the next question to Mrs. Vrushti Raj Nisar. Ma'am, a lot of our patients keep asking us, as caregivers, we are exhausted and anxious at all time. Is that normal? And where do we get support for ourselves and not just our child? Would you like to share something on this, please? Ma'am, are you there? Okay, I think ma'am's screen is frozen. She might just join back. We can go ahead with the next question for Dr. Pravitra. SMA type 1 with speech delay. Does SMA affect a child's speech and communication over time, or are there tools that can help these children? Ma'am, you're back. I have just given the question to Dr. Pavitra, and then we'll come back to your question, ma'am.
No problem. So
Oh,
sorry, there
thank
was some
No,
issue
no
there.
worries. No worries, please. Yeah, Dr. Pavitra, the question's yours.
Yeah. Thank you so much for that question. Yes, SMA type 1 do exhibit a lot of speech deficits also. There's a lot of difference, like when the caregivers bring the children to us. So, the difference between the child has motor speech deficits or the child has any language and cognitive deficits also associated to that. So, it becomes very important that we differentiate that the child is able to recept, the child is able to express, but the child has some deficits in terms of elaborately with respect to the speech motor articulation of the sounds, and the child has some reduced breath support, the child is not able to clearly say out few words. So there's a lot of distinctions that we try to rule out when we are trying to evaluate. So understanding whether it is only a speech deficits where the speech is not clear, from the child is able to understand, the child is able to speak out the words, but it is not up to the age and the milestones that the child is age appropriate milestone that the child has achieved. So we try to differentiate these two things first, and then we try to evaluate. So some children do have just the speech motor deficits where just the speech is not clear, whereas the other set of children, yes, they do have deficits where they are unable to understand few like age appropriate milestones for understanding and for communicating and expressing their thoughts and age wise able to express and they're able to communicate with their peer groups and with their caregivers. So depending upon the severity, we try to assess and we try to work upon whether it is the muscular weaknesses or is it the child is not able to have a conceptions with respect to different tasks. Is the child not given a good opportunity, or is it an lot of other behavioral issues related to the speech communication disorders that we see. So understanding what kind of trajectory that the patient shows, and eventually with the progression of age, yes, these deficits might be outblown a lot more, and the parents do come up and say that the child was able to do few tasks before, but now the child is not able to meet their communication needs according to the age. So that is something that we try to understand, and depending upon the severity, we can give them few speech enhancement techniques, few speech enhancement strategies that will help them communicate a little better, and we will try to involve them more in group sessions and individualized therapy treatment sessions. And eventually, if the severity is much more than expected, we don't have to wait for them to verbalize on work only on verbalization of speech. We can also put them on some kind of alternative augmentative communication that will support their communication much better, so that along with verbal communication, they also have other means of communicating, either a picture boards or they have a symbol board that will help them and ease out their communication strategies, and it will help the caregiver, yeah, my child is able to communicate. So the end points here and the standpoints here is to enable the child to communicate and not just work towards enabling them to verbally communicate. So communication demands is met for that child, and that's the end goal for us. And we don't have to work towards understanding, okay, this is the this is a 2-year child and we are aiming at 2-year skills here. No, we will try to look at what is the communication demand that the child has, what is the environment that the child has put up, and what kind of communication things that he requires, which is more individualized, that we try to frame in and work. So there are a lot of tools that will evaluate them, and there are a lot of caregiver checklist also that we can put in, and we can educate the parents. We are working towards these goals right now. If these goals are met and the child is able to communicate better and directly the frustration goes down, the overall quality of life gets better. There is a lot of tantrums that associated to this communication and behavioral issues that comes forward, so that can be reduced. So all of this can be tackled when we try to proactively assess every time when the child comes down, and we don't have to wait and watch. Let me wait and watch if my child can communicate in another month and another month. We can assess them intermittently and keep seeing what is the communication demand they have, and according to that aid in the child to start working towards helping them communicate and meet their social demands and participation.
Thank you so much, ma'am. That was quite insightful, and our mothers in the audience can relate, and they would be looking forward to these steps. Okay, coming to the question again to Mrs. Rushri Nisar. Ma'am, our caregivers, they keep saying that we are exhausted and anxious all the time. Is that normal? And where do we get the support for ourselves and not just our child?
Right. So definitely it is very, very normal to have any anxiety symptoms or having worry about the child, because just imagine a parent being told that your child has been diagnosed with XYZ, taking that in, and then firstly understanding about the disease and then giving the support that the child needs. Definitely it is normal to feel anxious. One thing I would like to add over here is that sometimes what happens is the parents become understandably very protective about the child. They try to start doing everything for them, and they keep on thinking about what's next, what can I do best for the person, what can I do best for my child, so that he he or she will have a comfortable life. Now, what happens over here is that because of all of these constant thinking, they often get into questioning themselves. There comes in guilt. And when the guilt factor comes in, at that time, if they are doing anything for themselves, they feel that okay, I should have given this time to my child, maybe. I should have done much more than this. So at that time, they will feel exhausted, they will feel anxious. Hence, at this time, it is very important to be a part of a support group, to talk to someone. And I think IFNR is doing a great job at this. Having a platform to ask your questions, to ask about how others are dealing with the same, is a very excellent initiative. So, one is definitely the support group. Second, I think, is to be aware about any hopelessness coming in, severe anxiety coming in, or maybe some sleepless nights. At this time, you should go on and take the professional help from a counselor or a psychologist, so that you are better equipped to then help your child in future. So it is normal, but please ask for the help at the right time, not when you have already gone into the burnout or you have already exhausted everything. Try to take help from your maybe neighbors, your family members, your friends. Give that some time to yourself for some self care. I think I have answered the question.
Yes, thank you so much. I think Alpna ma'am wants to say a few words, please.
Yeah, thank you. Sorry for interrupting, and thanks so much for the wonderful explanation. This subject is so close to our heart that I couldn't stop saying that we have a program. We used to have Rustum again is an integral part of the initiatives. We used to have something called Bedhadak Bol. So it was a program meant only for parents and caregivers separately, and for patients or individuals with SMA separately, where they can discuss whatever things they are feeling. So now that we have IFNR and we have Sathi, I thought this is the app platform where we can have professionals also perhaps join few of those. We can initiate again the Bedharak Board series and join us, because yes, despite all these things, the treatment, the multidisciplinary approach, emotional support is required, and it is required by both the caretakers, the families, as well as individuals with SMA. So we'll really look forward to collaborate more on this. And thank you so much, Dr. Hitav and IFNR.
Yes. So now coming to the last batsman for the day, who other than Rustam Mirani. Rustam, I'm going to give you a very question out of the questions that are given over there. I know you
Yes,
speak very impromptu and from the heart.
sure.
Rustam, one thing, you've been connected to a lot of patients with SMA, a lot of parents. How do you want the neuro rehab fraternity to improve as a whole? So, what are points which you think we should work on to serve you all better?
Okay. Do we have like 3 more days? Okay.
We're not
No,
that
no.
bad,
I'll make it succinct. I think the initial question was supposed to be about the government and the kind of systemic So thank you for throwing googly to a tail ender. Hitav. uh, the one thing that has always cropped up, that we have been discussing, even today, it has been cropped up. I think Dr. Saruja has mentioned it, Dr. Mona Patel has mentioned this. It's the aids and devices. Now there's so much of we can talk about all the advances that are happening globally. So currently I have been I had to put in crowdfunding for a new wheelchair of my own, which is made in America. It's a Pride wheelchair, which I've had more than 2 dozen wheelchairs in my life since the age of 15. I started on a manual wheelchair. I've been now progressively been using a power wheelchair as I grow weaker. But touch wood, I can still feed myself. I don't need the catheters. I still have very good bowel and bladder control. I can breathe on my own. So fingers crossed, all of these things and all the interventions that I have self-imposed on myself have been really, really good. But the biggest bone of contention is devices, aids and devices. Now, here's something there are now quite a few companies internationally as well as Indian companies who are doing towards it. But at the end of the day, they all remain pretty much, they're not clinicians. Most of the wheelchair providers, most of these people are just vendors. They are people who can procure you the devices. They can tell you the kind of options that are available, but what is it specifically that is needed for your own, like, daily functional abilities? They can't really help you with that. There was like a 21-page checklist that I went through with the person who is going to get me my new wheelchair. He's based in Europe. I have never experienced something like this before. When you talk about, like, pressure relief, for example, we don't have a system in place yet in any hospital settings which does seat mapping, pressure mapping. Correct me if I'm wrong. We don't know posturally if a person is sitting on a wheelchair like I am. Once you get past the teenage years, and if you're still very good in terms of independent sitting, how good is your pressure distribution? How well is your pelvic rotation? There are actually just belts and cushions that are now available anywhere. Even in India, you can customize those to actually correct your anterior posterior tilt, to correct the pelvic rotation, to do this. But in a clinical setting, I still don't see it. The other major challenge is whenever I go for any clinical assessment or just for a follow-up, for me, because I'm an adult who has seen it all, and, like, my progression is fairly limited. It's not as bad as a lot of other people. The major challenge is even during the examination process, because of the patients. For a kid, for a child, it's nice, but once you enter the teenage years, once you enter, you become like a semi-adult. Even if I go to a physio program, for example, just the idea of transferring me, for example, I go to aquatics, I've figured out my own way. I had to teach them how to transfer me, right? They were still very, very, very little clued in terms of the kind of options that are now available to transfer patients, for example, safely, which had again come up today in our discussions. Like, how do you do safe transfers? There are slings available. There are options available where you don't necessarily have to lift a patient by his arms or limbs. Thirdly, we are talking about all these advances made globally now with AI coming in, and, like, AI helping you do so many things. But we remain a country which is fantastically dependent on our labor force. But we don't train them in a way, which again goes back to the question you had posed to Vristi, like, the caregiver question, the big questions. Today, now, you might look at me and you might think, like, Rustam is so fearless in terms of how he approaches life, what he does. But my biggest fear is right now losing my caregiver system, which is my parents were both in their 70s. I've discussed this with Alpana as well, like, what next? I've discussed it with a lot of the moms who are part of the Cure SMA Foundation, who have now adult kids, Anushka, Pratyush. And they're so worried about when they see some relative of theirs who's in their 60s, for example, with SMA, and their parents are the caregivers who are well into their 80s. Why can't we think of an entirely different specialization where we train an entire set of people like they have in the Americas, where a personal care attendant becomes a mandatory discipline on its own, where you not only teach the person, like, palliative care and taking care of the patient, but also teach them, like, small little things like a bit of physiotherapy skills, for example. The person doesn't need to know. So physiotherapists like you, Hitav, could, like, actually tell that PCA as you are the care attendant. And this guy is also like a trained, certified PCA. It's not a run-of-the-mill caregiver from a service, which is what 99% of us pretty much today, like, look at. Like, my parents have been thinking that should we either do we think of Rustam ending up in a home of sorts where, like, that's his future, or do we allow him an independent lifestyle where we have, like, a trained set of individuals who can come and take care of him? And these are very serious concerns of mine. This is something that even I think as I grow older, like, like, what is my life next after my parents? Do I then have to look at, like, because my sister, who's herself a physiotherapist, has been, like, sending us pamphlets and brochures of all these real high-end fancy places now across India, which, like, take care of senior citizens and, like, people with disabilities. You just relegate them to these homes and you pay them a fee and they'll take care of you for the rest of your life. But then that, in a way, is going to take away a lot of independence, which I have damn well hard earned on my own. Like, despite my disability, I've got an education. I make a semi-decent living. I've been able to sustain and take care of my own life on my own. And to think of a future where I will be relegated to a home just because I've lost a support system, which is basic. It is not something that is very complicated or something that requires rocket science. Like, I can get all the neuro intervention I can get, but at the end of the day, when I'm sleeping in at night and I shout out to someone to just come and turn me in bed, do I need a caregiver, or do I need to then, like, get into a home where there's a nurse 24/7 who's going to do that for me? These are the kind of hard choices that a lot of us A child will not think of this right now, but we have known, and Alpana can attest to that. I have known teenagers as part of Cure SMA who lost a mother or a father, and that person has regressed within 6 months. Some have even passed away. And we never think about these things. We can get you the best of the best care. We can think of interventions. Why can't we think of making specializations in the caregiving space? Why can't we introduce that as a program in a medical setting, for example? I can see that happening very easily. I can see that a very lucrative business for a lot of the workforce that is pretty much lying idle. People who can work for Zomato and Swiggy can very well
Uttam,
work.
to answer your question,
Yes, Dr.
you
Surya.
very rightly put it. 2 months ago, as you know, that IFNR is a partner to the EBAS. I'm
Yes.
I'm the chairperson to develop a neuro rehab hospital in EBAS in New Delhi. In fact, I've already sanctioned to start a caregiver program for 6 weeks. And this is for all neurodisability, followed by another 6 weeks specialized caregiver program for, say, stroke, for epilepsy, or for dementia. So this is already on, Rustam, and
Excellent.
once
Yeah.
it forms, it will be also available at other institutes. You have very rightly you have put up a question. I have been thinking for it for last couple of years, and the two fields which I have taken a strong my thought on that and taken a strong base on that is, one is training of caregiver, and another is developing the trained neuro nurse for the rehabilitation. So
Wonderful.
the two
Wonderful.
things which are going to happen soon are these two. So your
Wonderful.
answer
Yeah.
is already been planned out
Thank
and
you.
on
Thank
the
you. Thank you.
function.
Wonderful. Yeah.
Yeah.
Yeah. So
Thank you, Rustam,
that's
for
what I was.
putting
Thank
this
you. Thank you,
point
Hitam.
across.
Yeah.
That is why I said, you said Bedhadak Bol, so I said I'm not giving you a question from the set of questions that we've got
No.
and
We
you
can
got
talk about
access
any
to.
topic.
You have
Yes.
to speak.
Yes.
And I could see Dr. Vineet also just looking at to his screen, and he was just thinking, this is coming from the heart. So, and thank you, Dr. Surya. I know you are one of the people who is a pioneer for family-based rehabilitation, involving family in rehab, involving caregivers into rehab and training of these people. So IFNR is doing their jobs under the able leadership of our leaders, our directors, and that's the way forward. Yes, we are
And
taking baby
Hitam, I would like
steps.
to add that all of you here today are the exception to the norm. It is so pleasant to actually interact with clinicians, specialized people from their fields and physios, because growing up and till as recently as 3 to 5 years back, we as neuro patients have to go through this entire process where we feel like we are in an assembly line of a factory. Even, for example, if you go to a physiotherapy setting, for example, it's so rare that you get the chance to work with a particular physio for a long term, right? You are pretty much handed from one physio to another. For workloads, for the physio's own career choices, they might want to move on to better things. They might want to move on to better centers. Of course, they also want to make a living. But you don't have a way to express the kind of frustration that you probably go through. Now, I am with my current physio that I'm with. We have been doing physio for the last year and a half, and it's so wonderful to actually have certain milestones, goals. You don't need a Hammersmith scale, or you don't need any of these fancy terms to figure out your milestones on your own. You don't need that. You see that in your functional abilities, you share these, and you're a physio who is so in tune with what you are going through on a daily basis, it makes such a world of difference. And when I listen to you talk and I've interacted with you, it's so refreshing to immediately get onto the page where we don't need to go into so much in-depth details of, oh, Rustam, what is it that is currently your problem, which is what happens whenever you're passed on from one physio to another. It's okay, tell me about your history again. And I'm like, oh boy, where do I start? Abhi phir se tujhe, I will have to tell you all my history. Can't you assess me in 10 minutes, 15 minutes, and I can just quickly tell you where I am at what stage of my life? And that is a level of frustration, but I know it's part and parcel of, going through a system of, and this is not just me. I think it's with any patient across the world who doesn't have a dedicated, system in place. Again, it's thanks to this initiative today, which I think Sathi would really, really go a long way. I think even if it has an option to have some kind of a database where we could actually share our milestones. And because that is something that even with Cure SMA, what is the challenge is us adults sometimes feel a bit left out because we have very limited access to the treatment options. A lot of the treatment options are targeted a lot towards children, but the children are going to become adults one day, and it would really help if adults can come together and talk about the kind of milestones they had, the kind of regressive milestones they had, the kind of difficulties they had, and it becomes a database on its own. It becomes a support system on its own. And again, I'm so happy to be invited today to this panel, which was impromptu, but I am loving it. So thank you so much. Yeah.
We will
All
have
right.
the stories, and if you send a story short video, we will put on that page, because that page is entirely for the patient and
Patients and
caregiver. So
Yes.
we would
Yes.
want the stories from the people who have the stories with them to be aired there, because that will be a guideline for the newers.
all right. And sir, we won't be having the next round of questions because we've all spoken with our hearts and we've overshot our time. And I know Dr. Surya is someone who just believes in time, but he's not yelled at us yet because he's also enjoying listening to the stories that have come out and the things that are there. But just I would ask Kalpana ma'am to just sum it up in like 1 minute and then we can end this session today because it's dinner time for most of us and we don't want to keep people waiting. Alpna ma'am, to you, please.
Yeah, so thank you. Thanks a lot. I would just first of all say what Rustam said, that has touched such a spot in for all of us that as a parent with SMA children, we all have this fear that what will happen to our child, what after us. That's the thought, a nightmare that we all face. And so many times, yes, Rustam, we had this discussion. We have with us my another founder and colleague Archana Panda. She has, it's a two generation with SMA. The brother-in-law has SMA, and parents are getting old. So I would like to, really have a better perspective on this. And thanks so much, Dr. Shurya, for initiating this. Not just the Sati, but yes, the rehabilitation care. We would like to learn more about the initiative that is much needed. That's also a neglected area. And I would like to extend our heartfelt gratitude to IFNR for launching Sati with collaboration on Pure SMA India. And this SMA Awareness Month, August actually is celebrated as SMA Awareness Month. This initiative is a ray of hope for SMA families. And it will become a true Sati, the companion or the guide that is needed. Sincere gratitude to all the esteemed speakers for making the today's webinar so insightful and empowering. Thank you so much everyone for your time and for addressing the families their question with such empathy, clarity, depth. Your guidance will be truly helpful to many of this. As you can see, there is overwhelming response. There are many questions in our chat box as well. We had collected, Dr. Hitav knows very well that we had collected many questions, and I know there are families, the SMA individuals who are messaging me that where is my question has not been answered. So I would say that we, as we have launched this platform, we can probably have some kind of forum where the questions also will be taken and they can be addressed by all the expert. So thank you once again. Thanks a lot for this wonderful and much needed initiative. Thank you.
Thank you. Sir, last words from you before we shut this session, sir.
I think I'm very happy and glad that this initiation of Sati has taken off well. Many people have joined this, and I'm sure in future much more number of people will be joining. I need support from all of you. Let's not look only at SMA, because SMA is just one part. Let us look at neurodisability as a whole. As you mentioned that the pressure measurement, this is equally important for spinal cord injury or traumatic brain injury. So let us look at neurodisability and then get the basic thing awareness to everyone who has neurodisability, and then we can address the individual disability into the detail little more. Once we have achieved a base, then we can go further. It is like if you have to climb Everest, first you have to come at Everest base. Once you are at base, then you can decide where you are going. So let us pledge that we all look at common neurodisability and work with IFNR to address that, and then take further forward specialized care for a special neurodisability. With that
100%
note, I
agree.
thank you all and
Thank you.
wish you all the
Thank you.
best.
Thank you, sir. Thanks a
Thank you.
lot.
Thank you.
Thank you. Thanks,
Thank you.
everyone. Thanks a lot.
Thank you,
Thank
everyone.
you.
Yeah.
Thank you. Thank you
Thank
so
you.
much.
Thank you, everyone, for the opportunity. Thank you.
Thank you. Thank you, everyone.
Thank you.
Hitav and Alpana, well done. Very well called.
Thank you, sir. Loved your wisdom and wise words, sir. When you not just spoke as an orthopedic surgeon, but as a human being treating another human being. Your that perspective is always the, I guess, USP of seeing a person beyond disability.
Rustam, so actually, if we are not being recorded, I would suggest there was a patient I saw.
Yes.
Around, it was just 2 weeks back, and I asked him, as usual, कि क्या हुआ था बताओ. So his T-shirt had a badge with a QR
Right.
code. So बोला, take your phone,
I did
click
reply
this
to you.
QR
Yes,
code
it's an
and
excellent suggestion. Yes.
my entire history
I
will
thought
come.
it's brilliant. Yes.
And
I think I'll
it allowed me to copy his summary onto my notes. Very simple.
completely. That's wonderful. Wonderful. I like that idea a lot. I'm going to implement it right now.
And Rustam, you have the wealth of knowledge on so many things, so that will really help put everything,
Completely. Yes, I'll do that right now. Yeah. Great.
And Mona, for you, what you can do is for every patient's treatment file, have a QR code and have a patient's Google Drive of
That's what I
all
was
treatment records. And every time a patient comes, just click on that QR code and you will go to the patient's Google Drive of the record.
Yes,
So
I mean,
simple
today we have
things.
the technological means to
correct.
really simplify these basic things, which can actually help us focus on the
Correct.
task at hand, rather than stick with the rigmarole of just going through the entire thing of wanting to know. Like, I think it really saves a lot of time, and yeah, it's fantastic. Yeah.
Because as a professional, we always struggle organizing the data and going through the data. So that was a
Correct.
phenomenal suggestion,
Exactly.
sir.
Yeah, that's a brilliant suggestion. I like it as well.
That's-
Yeah.
All right.
And sir,
All right.
sir, the way you say it, it is so amazing. You are an amazing orator. And the way you blend a scientific information with connecting it to life, it's amazing.
That's what I
And
was telling, not just that disease, but the human being along with
Correct.
treating. But thanks a lot. Thanks to you also, Munaji, and thanks a lot, everyone, for
Thank you, everyone. Yeah.
this wonderful initiative.
Yeah, have a good night. Thank you so much. Yeah.
Yes. Good night,
Thank you, everyone. Good night.
Good
Bye
night.
bye.
Thank you.
Bye.